Welcome to The Dental Brief, the podcast that delivers actionable insights and expert strategies to help dental professionals like you grow, lead, and succeed. I'm your host, Patrick Shavasty, the president of Omni Premier Marketing. Every week at The Dental Brief, we bring you real conversations from expert speakers that offer expert advice and quick tips that make a real difference in practices nationwide. Whether you're a general dentist or run a multi-location practice, we've got you covered with content that's designed to help you attract more patients, to streamline your operations, reduce headaches in managing your practice, and increase your profitability. If you're ready to elevate your practice, be sure to subscribe, hit the notifications bell, and let's dive into today's episode of The Dental Brief. Hello, everyone. Welcome to another episode of The Dental Brief. Getting ready to record this right before the upcoming Thanksgiving holiday season. Should be up right after Thanksgiving. Hope all of you have a great start to this year's holiday season, and we're getting ready to finish the year strong and ramp up for an awesome 2026. In that spirit, we have Mr. Lane Rizzardini with us. Lane, say hello to everyone.
Hey, everyone.
Glad to have you here. Yeah, it's glad to have you here. Sleep Apnea Leads.com is your URL. I think a lot of people probably can get an idea of what you do. You help dentists bring in more sleep apnea lead patients. You're a marketer like I am, so it's always great to have you on the program. Lane, tell us what's new in sleep apnea leads. What's the trend? What's going on?
Yeah, I think so. Our push this year was to, there's a lot of, as you know, there's a lot of digital marketing agencies out there, right? And there's a lot of like niche digital marketing agencies out there. And I think our focus this year was to not just be a digital marketing agency for sleep apnea. We really wanted to be a dental sleep marketing agency. And so if you really want to get, build a thriving, sleep practice and you're a dentist, there's really three avenues through which you get patients. There are your existing dental patients, right? And so you have your posters in the office and brochures, and you can have demonstrators, and you're screening your patients. And that's always where everybody starts. A lot of your patients that are already coming in probably already have sleep apnea, and they're worth screening all of them. And so your dental marketing that you're doing with Patrick can really help, start the process of developing your sleep pipeline and get that going, get staff going, practice everything. But eventually you run out of dental patients, right? Or you really want to get to a point, maybe you want to get out of dentistry altogether. Maybe you have bigger aspirations. You want to do 10, 50 appliances a month. Then you got to move on to other things. One of them is what we've historically been really good at is direct-to-patient marketing. Build a website, build a sleep brand, do Google ads. But the things that you will hear at all of the conferences and shows that you go to is, hey, that's great, but like, if you really want to be serious about this and grow a practice and have it scale really affordably, having a consistent stream of physician referrals is really a huge path to growth that is really important to also have patients coming in so that you're not totally reliant on Google or Facebook and the next update screwing something up with your SEO. You have physicians coming in that are delivering you patients. So that's where we spend a lot of our time and emphasis this year in really building out a program that is effectively creating physician referral relationships for our dentists with all kinds of dental office focuses in the area.
Yep. I agree with you 100%. Having a steady flow of referrals coming in from physicians is the most scalable way to build a sleep practice. So why doesn't everybody do it? So what's the problem?
It is really time consuming and takes a long time to build. So you basically have to, so the nice thing about digital marketing, right? You build a website, you build a Google Ads campaign, you press the on button and you give them your money and you're showing up number one for all those people, right? And you can get patients like right away, right? Without having to leave your office or change anything about your schedule, right? Like we can do that for our clients. With the offices, you have to do, first of all, you have to have a few things in place. You have to have medical insurance. Most of these offices that you're going to go to, they care about three things. We call them the 3 C's. It is cost, care, and collaboration. So the first thing is cost, right? They care that are my patients going to pay the least amount out of pocket if I send them to you? Now, yes, part of it is that they care about their patients and they care about their financials. The other part is that if they start sending their patients to someone that, and they find out, well, they're going to charge you $3,000 for this thing, those patients come back to that doctor mad now. And they
Right.
start hearing what's right. And they don't want to have mad patients. So there's
Right.
not even going to risk it. Even if they believe in the treatment, you got to really take my patient's insurance. And so that is one thing that a lot of dentists are willing to do.
Right.
The second thing is care. Is my patient going to get the highest care possible? A lot of times you demonstrate that by getting some sort of, you either become a qualified dentist with the AADSM or you become a diplomate with the ABDSM. A lot of times physicians, when you go and talk to them, a lot of the skepticism comes from there's a dentist down the street that's doing this and he does a terrible job. He's putting silent nights in your mouth and charging $300, and patients are coming back with TMJ, or they just think that any dentist can do this. And they're like, why should I refer to you? And you say, you're right. And the answer to this objection is, you're right. You shouldn't just refer to any dentist. They're going to screw it up. You should refer to me because I have gone through all the proper training and done the certifications. And, here's all my results from the past patients that I have had. And so you can demonstrate that you have superior care. And then third, it's communication.
Yeah.
Are you going to collaborate with me basically on this, patient's treatment? Are you going to take this patient and send them somewhere else? Am I never going to see them again? A lot of times that involves using some sort of software that allows you to do SOAP notes very easily and send letters back to the doctors and keep them in focus with kind of what's going on with that patient.
Sure.
So you have to have all that stuff in place, right? And that right away is a lot of dentists are like, yeah, that's a lot of stuff, right? But then you also have to be willing to take time out of your schedule or hire an entire staff member that's going to do the research on what offices in the area are going to be good fits for you. So that takes time to do all of that prospecting. And then you have to either make a lot of phone calls, which in our experience, sometimes it takes up to 60 phone calls just to get, a handful of meetings. You don't have time for that. Or you're going around and you're doing door-to-door sales. Essentially, you're going into an office that cold, you've not been invited, and you're talking to gatekeepers and you're collecting information, and then you're trying to get a lunch and learn, trying to get a meeting. If you get a lunch and learn, you're feeding a staff sometimes of 20, which is not cheap, right? So now you're paying $1,000 for a lunch to maybe get 10 minutes with a doctor who, if you assuming then you get over all of the kind of objections that they have, it may take a couple months for them to send you one patient. Then they send you that one patient. Then you have to get that patient through the process. And then at that point, when you've had a successful outcome with that patient, now you can start getting referrals, right?
Yeah.
And so it's just so hard to do. Everyone talks about it being the gold standard. And if you see here, the most successful practices on stage, it is most of their patient flow. And they make it sound like, oh, it's this thing you have to have. And then you get in the nitty gritty of it. And it's wow, this is really difficult.
Sure.
And that's why so many of the small practices are not able to do it. And so that's why we've tried to develop a service to at least try to make this a little bit easier and try to take a lot of that legwork off of the practices so that all they have to do is show up. And then we help coach and that sort of thing on how to get it going.
Yeah. I mean, you're talking about going in cold. I mean, a lot of practices have signs up right on the door. Says no solicitations, right? You kind of stopped cold right there. So tell me, how's this work with you guys? So again, website is sleepapnealeads.com. I know I encourage people to go check it out. If you're looking to get serious about your sleep business, give it a look. Certainly give Lane a call. This is what he does. But tell me what's your approach to this, Lane.
Yeah. So what we did, the first thing we did that was really unique is that, I'm a digital marketing guy, right? And I don't have experience, frankly, going into offices and doing this. So we actually hired someone that led a sleep office, a dental sleep office. She worked in the dental office, led the sleep office, went through all the training, worked at Prosomnus, one of the big appliance manufacturers, was the sales manager for the Northeast. She came in and helped us develop this whole program based on her hands-on experience doing this for her own office and then later hundreds of offices through Prosomnus. And so she just has this crazy amount of experience with any sort of kind of one-off objection counseling. So just having her in there is really valuable. But you start with your folder of materials, right? So you get your folder, everything's branded, right? Get your Mallampati scales, your Epworth sleepiness scales. You can hand out brochures and materials. And really the most important piece is your brag book. That it's basically your pre and post AHI and ODI readings that you've had from patients, that you've successful outcomes that you've had. You have to bring that. You can start with your best 10, but eventually you want to show the doctor that you're not cherry picking. And so you, at some point when you're doing enough volume, you bring your last 20 basically. And you have to have that to showcase the care that you're providing really good results for the patients. So we develop all that, print that, send it to the offices. The next step is we're doing all the prospecting. And so the office types of and choices that you make in the offices that you go to, there's some strategy here. So yes, everyone knows that like pulmonologists and sleep labs and, cardiologists are kind of like, they have a lot of sleep patients coming in. They have a lot of volume, right? The problem is that, like I said, everyone's thought of them. That means they probably already have someone they're referring to. They're getting a million calls for it. Our strategy, usually we like to try to find low-hanging fruit that is maybe not as called upon and maybe has lower volume, but maybe get you some quicker wins. So think like the connection between weight loss and sleep apnea, right? So there's obviously a major connection where if like a lot of times if you just lost like 50 pounds, you would like solve a lot of your issues. Right. We talk to bariatric surgeons a lot. Like that's really high on our list to like really start the prospecting with. Weight loss clinics are now like testing a lot, right? Yeah. Anybody that's prescribing Zepbound, I guess would be like an option of like, hey, while you're getting weight loss down, like the oral appliance can really help bring your AHI down in the near term. And so we're putting together that prospecting list for you, coming up with like, hey, here are like the top 15 that we should really focus on for now. And then we go out and we book the meetings. We're scheduling them. We're all doing everything virtually. So we're making a lot of phone calls. You have some tricks and some apps and some tools that we use to try to find opportunities for open lunch and learn calendars. So we're booking meetings for our offices. And then the offices, our doctors, our dentists go in and do those meetings, do those lunch and learns. And we're really helping coach them on the script. What are you saying? How are you talking? What are you supposed to do when you get in there? What do you say? What objections are you going to get? And then once they go and do them, they come back, okay, and we help like do the nurturing afterwards. Like how kind of follow-ups do we need to do? That sort of thing. And so that's really how our program works, trying to get a couple like quick wins in the first 3 to 6 months and then continuing to grow it from there.
Yeah, that's smart. I love it. People want to learn more about this, sleepapnealeads.com. Yeah, easy. Some great tools on that website, some things to check out, some cool calculators, big red schedule a meeting button. So I encourage you, if you want to learn more about this and getting cold outreach going, or getting warm outreach going, I should say, getting into practices, making those connections and building those relationships, reach out to Lane and his team. Lane, thanks so much for coming on today. We really appreciate you.
Hey, thanks for having me. Good to talk to you again.
Thanks for listening to this episode of The Dental Brief. If you found it helpful, give it a thumbs up, subscribe to the channel, and share it with a colleague who could benefit. We're here to help dental professionals like you stay ahead of the curve, one brief episode at a time. You can find more episodes and resources at thedentalbrief.com. You can also join the Growth-Minded Dentist community on Facebook. Links are in the description. Until next time, keep learning, keep growing, and thanks for being part of the Dental Brief community.